1,000 or $50 on 1,000, or 5%. So this is a return of 5% per year. Today in the banks in Canada, the typical return is about 1 or 2%. I don't know what it is over here. Is it similar? Basically, the banks make good money and we don't. So, but that's usually the way it is. Now, I should have become a banker, but it's too late. Cost of the equipment. Let's take a look at the cost of the equipment. Some equipment is bought as a cash expenditure. You pay it all at one time. You take out your money from your pocket, and whatever it costs, you pay it, and it's yours. Some you pay over a period of years, where every month you pay over 3 to 5 years. This is called amortization. And you should amortize the product over the lifetime of the product. So let's say you expect to use a product for 5 years. The amortization period should be 5 years also. And higher cost items are usually amortized over 3 to 5 years. This is a typical business procedure. Nothing new, just as dentists, we don't know about it. Let us say we have a total cost divided by years of usage equals the annual cost. So if a product costs $24,000 and you're going to use it for 2 years, your cost is $12,000 per year. If we take that same cost, the annual cost, and divide it by 12 months, our monthly cost is $1,000 per month. So this is the way that we can figure it out. How much does it actually cost us per day? If we take our $1,000 per month and divide it by 20 working days, this product, this equipment, is going to cost us $50 per day. So now the question becomes, can we make more than $50 a day with this piece of equipment? Because if we can't, don't buy it, don't look at it, don't be interested in it. It's not for you. If you can make much more than $50, yes, that's a good decision. That probably will work in your practice. Only you can make that decision for your practice. But this is a very important decision. Now, over here, I'm going to have to go here because I can't see it from the side. This is my purchase analysis and decision making. This is a little sheet that I have, and you can download it from my website, actually from my, write me an email, and we'll send it to you. You can print it out. No royalty, no charge. Just print it out anytime you want, and it lists a few things. Now, what does it actually say? Well, it helps us to make a decision in this way. We're going to take a look at the ozonics. Patient interest. When the patients find out about it, are they interested or not interested? Well, it's not invasive, no drilling, no pain, no freezing, and they're going to have immediate relief. That's probably a good thing. So they actually have a lot of interest. Promotional value, if you can get this information into the newspapers locally, or radio or television, you can get a lot of free advertising. The best advertising is free advertising, because it doesn't cost anything. So that's a very good thing. What can you use it for? Uses in my practice. Uses in my practice, perio, major use. Implants. Implants on 2 sides. 1, when I place the implant. 2, when I want to clean out the area for depressions. And 3, if I've got periimplantitis. If I've got periimplantitis, that's a major problem. I just heard yesterday that, or today perhaps, that 30% of implants that are lost because of periimplantitis. Herpes, aphthis, and endo over here. So the question is, how much am I going to charge? Well, let's take a look over here. I've got a 5-year lease, $12,000. The ozonics cost about $10,000, but the interest over 5 years will probably be about $2,000, approximately. So let's say over 60 months. And if we take a look at over 5 years, that's $2,400 per year is what this unit will cost. $2,400 per year, which is $200 per month, which is $10 per day. Now you're starting to see how I make my calculations. So the question is, can I make $10 a day, not 10, can I make $20, $30 a day with an ozone generating unit, with ozone therapy? And we charge 2 different levels of prices. We charge 20 for minor fees, for minor procedures, and 50 for major procedures. We use this fairly often for our patients. And we do it a lot more often than I will tell you over here. But if you can see, let's say, just $20, forget about the $50 charge, just $20 per use with 4 patients a day. Do 4 patients in your practice every day have periodontal problems, implant problems, aphthous problems, herpes problems, lip problems, any problems? Of course they do. If you can help them, $80 per day. What's $80 per day? Not a heck of a lot. Can't even buy yourself a good fish dinner, right? But $80 per day is $1,700 a month. Over a year, it's $20,000. Now, let's compare the $20,000 that this is generating. This is a very conservative amount. You're going to see a lot more service. The ozone, the ozone unit that we started using a number of years ago, we were using 20 times a day or more. Not 4 times, but 20 times a day. Because the hygienist uses it, I use it. So let's see what this $20,000 means in terms of business. Income per day, $80. Cost per day, $10. Net benefit per day, $70. Does that make sense? If you could get $70 every day, net, is that a good purchase? I think so. So my decision is yes. Not every product will have this relationship. And not every practice will have the same set of numbers. Return on investment, income per year, $20,000. Over here, sorry. Income per year is $20,000. Total annual cost is $2,400. Income ratio is 8.3. That means my return on investment is 830%. So, it's high benefit ratio over here. The return on investment is 830%. And my gut reaction is not a mental reaction. It's not a logical reaction. What does my stomach say? What does my heart say? That's my gut reaction. Well, when I look at 830% return in a year, my gut reaction is, hey, I have to look at this a little bit further. Maybe I consider it. And then my decision is yes, over here. But you see how I arrive at my decision. And I'll leave you my email. It's udec@rogers.com. udec@rogers, ROGERS.com. We'll send you one of these. Just ask for the ROI sheet, and you'll get one of these, and then you can print it up as many times as you want. This is what I walk around conventions with. Whenever I see new equipment, I take a look at it. So what does this mean? Ozonics return on investment. Net income, of course, we saw this before, and certificate of deposit realistically returns $20 or less on a $1,000 investment, or an ROI of 2% per year. Ozonics returns $20,000 on a $2,400 investment, ROI of 830% per year. You figure it out in your own practice. These might not be the numbers that you get for your practice, but this is the way that you should analyze every new product and every new technology to see if it's going to make sense. I guarantee you that you will have fewer products in your back room if you make your decisions on this basis. So, to a healthier future, thank you very much.